So now that it's kind of July 4th weekend, I've got a little time to do a couple educational videos I wanted to do. The first one was going to be about facelift incisions. So there is a lot of concern when patients are searching for facelifts as to what kind of facelift to look for and where the incisions are placed, and should I do an endoscopic one or an external one? Do you hide it in the hairline? Do you put it in front of the ear? Do you put it behind the ear? Can I wear my hair in a ponytail? Is anybody going to see it? All these different things. So the first thing to know about facelift incisions and scars is that scars tend to form on the face not because of the way it was stitched necessarily, but because how the skin was placed back together. So if two pieces of skin, let's say you just cut yourself here and you cut it, you don't move anything, and you stitch it back together, even if you do like a not great stitching job, it's going to disappear almost certainly, unless you have a step off or something strange. So when there's no tension and it's a good area of the face, which people call in the H zone or the T zones or things like that, or just on the face in general, it's going to heal well. So you don't need to worry about scarring in those situations. Why do facelift scars form? It's because you came and you pulled on something and you stretched it and you attached it up here. And human tissue is not like wood and nails that you could just hammer into place and it stays. It's soft and it's constantly undergoing refreshment of cells. So as the cells reform and as there's tension on the soft tissue, the stitches that you place can just kind of tear through the tissue, and then it can start pulling away. So you close something with tension, and as it starts pulling away in its wake, meaning in between the incisions or in between the flaps, it starts to form a scar. The scar can be atrophic, meaning it's flattened like a hammock or a stretch mark, meaning it's missing collagen and dermis. Dermis is the thicker part of the skin. Or it can be hypertrophic, which means it can be thickened and red and raised. And that's a disarray of collagen that's forming reactively as a thickened red raised scar. That's hypertrophic. Most people confuse that for keloids. Keloids are like a tumor. Keloids are very different than hypertrophic scarring. Keloids are like a tumor, different type of collagen and different behavior, where it actually will just grow like a tumor, a different array of collagen all the way outside of the incision line like a ball. Or like a big raised mound. So that's very different. So the main thing to consider when doing a facelift for scarring is it a high tension facelift? If it's a high tension facelift, you're going to have a scar. There's no way to avoid it, no matter how amazing of a seamstress the surgeon is. So the low tension facelifts are the ones that don't scar. How do you know what a low tension facelift is? Well, you have to look at the scars. You'll get an idea from that. They have to have no look of pull in their face. If they have no look of pulling in their face, there's less chance of them having tension on the incision. If they get a big difference in their face, there's less chance of having tension in the incision. A big natural change. A big fake change, they're going to have tension. A big natural change means you lifted something without tension in a natural vector and put it back how it's supposed to be, so you don't tend to form a scar. Out of the facelift types, we'll categorize them into maybe 2 or 3 different types. Okay, one of them, when we're looking at hidden incisions, is an endoscopic facelift. And the endoscopic facelift, there's endoscopic mid-facelift, which you can make an incision down here, release the mid-face, release the brow, and it necessitates a brow and mid-face lift together. You can't just lift the mid-face by itself. It's not going to stay. You have to bring the eyebrow up together. Some people combine that with other types of endoscopic lifts, where you can come down and actually release some of the tissue here and set it back. So that's called an endoscopic mid-facelift, endoscopic brow lift, and there are different brand names by different doctors who perform them. And they say that there's no incision around the ear for those, which is true. They can do it that way, or sometimes they say there's no incision around the ear, then they go and they actually lift from this part and they see, okay, I have skin excess, I have to remove it, and they end up putting an incision around the ear, and you wake up kind of surprised, and why'd you do that? But having a scar, so that's an endoscopic. Then there are the external ones. The external lifts, there's 2 different types of incision patterns. One of them is called a temporal tuft incision, which means it goes around this. This is called the temporal tuft of hair. It goes around that, goes back over here, can go either into the ear canal and behind it, or in front of the ear. And I can draw that for you, I think. let's see, out on my patio here, so you can see it better. Okay, pulling up an ear photo to draw on. Okay, so temporal tuft incision is what I do, and if I can figure out how to mark this up, it would be fantastic. Mark up. There you go. Okay. So, looking at this ear, sorry for the reflection, a temporal tuft incision is one that comes right along here, and then you follow into the crease, meaning in front of the helix where there's a natural subunit separation. And then from there, you can choose, do I want to go pretragal or retrotragal? Pretragal means it comes down like this, and it goes back behind the ear, all the way up, and then back down over here. Retrotragal means that it comes back here, goes on the back side of the tragus, comes back, goes across on a stair step, and then comes back down. These two types can both heal seamlessly. It just depends on the surgeon that's doing it. So there's no need to tell your surgeon, I want this one or that one. I prefer to go in front if I can, because then you never blunt this area, which is called the incisura. When people lose or blunt the incisura, the ear itself can look a little tiny bit operated. Not a big deal, not a big discerning difference in between. So that's how I choose between them, is just if they have a strong incisura or not. If they don't, then I go behind it. So that's a temporal tuft incision. Another way doctors do it is to go up in the hairline here, and they make an incision. That's called a hairline incision. You go inside the hairline and you connect this down, same way, either in front or behind, like that. And again, you go around the back. Doctors who do that tend to, instead of following the hairline down like this, they tend to go into the hairline. Okay, and those are hidden incisions. So hidden incisions have their own issues, which I will go over. So let's go back to the endoscopic. The big thing to know with endoscopic is that it's an incision here in the hairline, and people do that sometimes because they don't want cuts around the ear. Some surgeons do this amazingly well, very few actually, very few in the world do it amazingly well, and the rest have a high failure rate, meaning after about a year the endoscopic lifts fail. So if you were talking about the majority of surgeons out there, the majority, probably 90+%, cannot get an endoscopic mid-facelift or an endoscopic brow and mid-facelift to stay longer than about a year to 2 years. There are certain surgeons in Beverly Hills that I know of and around the world who are able to do that, and they're very well known because they can do something that other people can't do. It does usually necessitate a little bit of fat grafting in the face to provide support, but it's a nice procedure. It does not inherently separate the tissue layers and roll them over each other. So, but that's a different discussion about result. Results are a little different. Both great aesthetics, though. So, what can happen with an endoscopic lift? Number one, let's say it's not done well, you can get a scar still. You can get a pretty nasty scar in the hairline if it's not done properly. And I'm not talking about the good surgeons like Chachi Ko and those guys. They don't get those kind of scars. They're the really good surgeons. I'm talking about surgeons who just, are not that great at it. They can get an indentation here where you lose the temporoparietal fascial layer, isn't it missing? And the dermis adheres down to the scalp. And when that happens, you can get hair loss. So you can get a big scar of hair loss and you'll never be able to fix it. Okay, so you can still get a scar from a scarless facelift. What else can happen? Down here you release and you pulled up the neck to try to get a neck lift out of it. What happens over time when you try to pull the neck up, didn't get good release, that's no tension, there's tension on there, even though you went endoscopically or through a small incision behind the ear, is that it can start pulling the ear down. When the ear gets pulled down and it's attached earlobe, they call that a pixie ear. That can happen with an endoscopic lift. When the earlobe is detached, like my big floppy ear, and it gets pulled down, they don't really call it a pixie ear, but it is. It's the same kind of thing that's happening. You get a vector change on the ear, meaning the ear tilts forward and it starts to get longer. So all of a sudden you look like you have a long, older woman earlobe, or older man, depending on if you're a man or a woman. And the vector changes and it pulls down and it looks strange to people. So even though you didn't get a cut around the ear, you can still get negative results from it around the ear. You can still get pulling and vector changes and lengthening of the earlobe. So all this stuff can still happen. So it is a complete fallacy to believe that an endoscopic lift can not cause problems with what we would call scarring or effacement or deformities around the ear. So they can still happen even though you didn't make a cut, and they happen very often. So, and again, not by the best surgeons, but in general, if you're talking about the majority of surgeons doing endoscopic lifts, if they don't just do this and they go and try to lift the neck through a small incision, it can pull the ear back forward. Now, maybe most surgeons won't tell you that because they don't notice it. It takes a high level of acuity, of visual acuity, to be able to see this, meaning I've seen hundreds and hundreds and hundreds, and I see it very easily. Most surgeons can't see it. So they'll tell you, no, there's no other issue. But these are issues you can have with endoscopic lifts. It's important to know that. And when you're looking and analyzing the results of your surgeon, you should be looking at the ear before and after to see if it changed. And if there is pixelation there, if you see pixillary changes on the incisions, then you know that they photoshopped it, which happens. And usually they Photoshop this part down here, this part, but not this part. The reason they don't Photoshop this part is because most women's hair goes across it, and if you try to Photoshop that, it looks like it's blurred out. So if you see any blurriness here, I'd have a little hesitation. If a surgeon has hair pulled down in front of the ear in 100 photos, you should also be very cautious because they're hiding the incisions, and that is not necessarily a dishonest surgeon, but it certainly is not an honest surgeon. So you have to be very cautious about that. They should be showing their hair in all the photos. Okay, that's for endoscopic lifts or open lifts, anything like that. So now getting back to the hairline incisions. We look at the temporal tuft incision. The benefit of the temporal tuft incision is tremendous. Anybody who's going to lift a face, if they're going to lift your face, they need to inherently make a temporal tuft incision because the cheek is going to come up and that skin has to be redraped and redistributed. If they're not going to lift the cheek, then they can get away with making the hairline incision, which has a lot of problems. So the reason people don't make a temporal tuft incision is because they have tension on their facelift. Rather than fixing the problem with tension on the facelift, they say, I'm not going to make a temporal tuft incision, and I hide it in here. Most surgeons that get good movement on the face and don't have tension, they make a temporal tuft incision because it heals better and it leaves the sideburn intact, which is a very, very important thing. So I prefer a temporal tuft incision. Pretragal or retrotragal, I only determine based upon the strength of the incisura, the strength of that cartilage coming across. If it's strong and I want to keep it very sharply defined, I will go in front of it. If it's blunted, I don't really care so much. I'll hide it. It heals a little bit faster because the skin back here is thinner and it heals faster than in front of the ear. And the one in front of the ear tends to indent, so you have to do a lot more work trying to evert it. Now, the biggest mistake I've seen in facelifting is this. So, hairline incisions. Why do people make an incision hidden in the hairline, and what's the problem with it? People make this incision because they have tension on their facelift and they want to hide the incision. So that means that they have an improper surgery that is not going to last very long because it has tension on it. It's going to fail and it's going to scar. And rather than fixing the problem at its source, which is getting rid of the tension, they hide the result of that problem, which is scarring, and they try to hide it up in the hairline. Big problem with that because it'll still scar in the hairline. It's a scar and it happens because of tension. You lose hair over there. The other big problem is that that moves up your sideburn. So all of a sudden you lose this. Imagine me with no sideburn up to here. If you look at me from the front, that'll mean that my cheek goes from here, comes up, and ends all the way back here at my ear. If I have no sideburn there, I look like I have a long flat cheek. Now let's say I'm somebody who did a hairline incision. It also means I'm doing a SMAS plication. And if you're doing a SMAS plication, which inherently is a slightly illogical surgery, you're going to be lifting the skin, grabbing the SMAS, pulling it back, which pulls on the muscles of the face slightly, redraping the skin and putting it back. But because you did such a long skin flap, you tend to get hollowing on this lateral portion and you didn't get any redistribution of volume. So now you've hollowed yourself laterally and you've lengthened the cheek to go all the way back here. Now you look operated. So hairline incisions, for that reason, I do not like. I don't like when anybody moves the sideburn up. It lengthens the cheek. You're already flattened on the side after a SMAS plication. And these are things that make people look awkward. They make them look older. They make them look less contoured on the cheek. And even though you went and got rid of a couple wrinkles, you worsen them 2-3 other ways. Surgery should not be like that. The trade-offs should be minimal. The gains should be big. You shouldn't say, well, I'm going to hide an incision, but then I'm going to damage you 2-3 other ways because of it. that doesn't make any sense in the world of surgery. So hiding incisions in the hairline up here is inherently, in my world, a negative thing. It doesn't have any positive benefit, and it only has negative issues that come out of it. Hairline back here. If you follow the hairline down, it heals pretty well if there's no tension. Some people like to hide it by going into the hairline. That creates a natural step off in the hairline. You can no longer wear ponytails comfortably, number one. Number two, the neck lifts vertically in this direction. If you do a step off in that direction, you can't get rid of that excess skin or lift it properly. So it makes it more difficult to get a big neck lift when you're hiding the incision here in the hairline. Those are the issues with it. So in the end, for surgeons, it's typically, rather than hiding your incisions, it's better to get rid of tension. Any kind of lift that you have that has tension will fail, will scar, right? We're not made of steel, we're not made of wood, we're made of flexible, soft tissues. When you lift, you have to get rid of all the tension, close with no tension. It's not gonna benefit you to pull the skin. Here is another big area where people make mistakes, same idea. Temporal tuft incision comes around here. Why do temporal tuft incisions generally scar? Is because doctors cut out skin in this direction. So from here they go and they pull this back a little bit, and they try to get rid of a little excess skin in that vector as they're doing their temporal tuft incision, and that scars. Why does that scar? Is because there will always be tension in this direction, because nobody ages like this. Nobody gets wider here with time and then you have to go shorten it. Brows come down, there's laxity in this direction. Cheeks go down, there's laxity in this direction. This is the vector of aging. So you can brow lift, you can cheek lift, you can do everything up this way. Laterally, if you pull it, you're naturally going to have tension on that incision because nobody ages in this direction. So that's why temporal tuft scars tend to form. No, I'm not married. Don't have a girlfriend either. So answering questions. So if anybody has any questions now, we can go over them. Hopefully you understand. What is your average wait time for scheduling a surgery? That we don't know. It's kind of sometime in the next 3 months, but we are very flexible and kind of shift around the schedule as much as possible. So we'll see if anybody has any questions I can answer here about facelift incisions, but I hope everybody understands that making an endoscopic incision does not guarantee anything. Making an incision in front of the ear, behind the ear, these things don't guarantee anything. The main thing you need to do is do a tension-free lift, and this goes with lip lifting it well as well. So lip lifting, the way I do it, is called a deep plane lip lift, and that releases all the tension, which is why they tend to scar much, much less than other ones. Doesn't matter how you close it, it does, but the main thing is getting rid of the tension before closure. So let's see, any questions here? Can I come to Germany? I wish I could. So do I just do neck lifts? No, or do I just neck? I do neck lifts alone. I do face and neck lifts. A facelift and a neck lift is kind of the same surgery for people to know. The difference is just where the incision ends. Any patient I've done an isolated neck lift on has generally regretted the fact that they didn't just tell me to go around the hairline right here and bring the cheek up too, because that makes people look just more refreshed. It never looks fake or anything like that. So it improves the nasolabial folds, under eyes, melolabial, and those kind of things. That's it. The other thing I would say is there have been a couple surgeons in Beverly Hills and elsewhere that try to say that certain lifts don't work, and that they've been doing it for 20 years and they don't work. You have to understand that certain surgeons don't have the talent or ability of other surgeons, and in their hands a certain procedure might not work, and so they've dismissed it in their minds. It does not mean that another surgeon can't do it. You have to go research yourself, look at the photos. If you see 100, 200 photos, reproducible, not photoshopped, of another surgery done successfully and great reviews on it all over the place, and you know the surgeon's a good person, you can pretty much judge for yourself that the other surgeon was wrong. They're an old school kind of surgeon, or they're just narrow-minded, narrow-sighted, and live in their own little world, and that the other surgeon can do it. Alternatively, sometimes some surgeons misrepresent their photos, so then yes, there's one surgeon who can do things others can't because of the photo manipulation. So hope that answers all the questions, and we'll post this later for anybody who wants to see it.